Hi, everybody. Welcome to our session on doctor and patient healthcare trends on Twitter. I'm Seth Duncan, Chief Data Officer at W12 Group. I'm joined today by Lisa Bookwalter, who is a Director of Twitter Client Solutions in Healthcare, and also by Austin Chang, MD, who is an Assistant Professor of Medicine at the Sydney Kimmel Medical College. So Twitter's played an integral role for a long time in conversations that happen between patients and caregivers and physicians and public health officials. However, within the first 5 months of the start of the pandemic, we saw a 93% jump in patient engagement with physician content. So we want to dive into what's driving some of this engagement and what these changes might mean for the future of healthcare, and especially for how healthcare professionals and physicians interact with their peers and with patients online. So Lisa, starting with you, we've seen this massive uptick in engagement since the pandemic. Do you think that's going to continue, and how so?
Yeah, that's a great question, Seth. I think absolutely. I think COVID really has been the great accelerator for so many trends that were already underway, and particularly when you look at it in health. And I think the uptick in telemedicine is here to stay. I think it is giving patients back their most prized resource, which is time. I don't think anybody misses going and sitting in the waiting room in doctors' offices. I think it's also changing the way patients view health, and you're seeing so much engagement on Twitter around thanking healthcare workers, around using platforms like Twitter for public health. There was a safe hands, hashtag safe hands emoji that was Twitter as well as Facebook, Google coming together to really educate people around that. So I think Twitter being a forum for public health, Twitter being a forum for HCPs talking to each other, and definitely Twitter being a forum for patients talking to HCPs is here to stay. And I think there'll be a little bit more of a balance when the pandemic is over, but I think the digital transformation is absolutely here and here to stay. And you're going to see more and more of that play out on platforms like Twitter.
And Austin, I think sort of to Lisa's point, this is likely to continue. And one of the things that I often see, and a lot of my colleagues see when it comes to how physicians leverage social media, is that there's often a combination. I mean, I should say physicians have some sort of unique combination of different types of superpowers. Some are really good at peer-to-peer, kind of scientists talking to other scientists or researchers talking to other researchers. And then there's others that are really excellent at like disease awareness and advocacy, or even in some cases, kind of patient education and engagement. And actually, it's interesting. A couple of days ago, I was looking at your Instagram feed, and I saw you had a really great post about, it was essentially addressing some of the myths that surround treatments for non-alcoholic fatty liver disease. And the information that you even had was really specific. I mean, but it was friendly enough that I think a patient could understand it, but specific and sort of specific, and also had enough references that even a medical professional would find it interesting. So I guess my question is who are you usually trying to address? And really, I guess, how do you kind of find that balance between addressing a consumer audience and a professional one? And how do you kind of play that balance in a responsible way?
Yeah, I mean, I think that it depends on which platform I'm using. And that has shifted over time, like who my target audience is. Initially, it was my colleagues, and on Twitter, I think a lot of that discourse is still targeted toward my colleagues and other health professionals. But on Instagram, for instance, it is more public-facing, kind of patient-facing. And so I think that, for other health professionals, the most value is gained from wherever the physician can communicate the best. And I think that I am very mindful about avoiding medical jargon and just making sure that the patient is at the center of anything that I'm trying to communicate, so as not to further erode trust in healthcare, and making sure that I am citing my sources and making sure that any disclosures are put out there so that there's as much transparency as possible.
And I guess sort of to that kind of a follow-up question is, can you talk a little bit about how you and other doctors use different types of social media platforms for different purposes?
Yeah, I think that each platform seems to have a you know, a different format, right? And some are more text-based, some are more video, audio-visual. And so we kind of capitalize on our own strengths and see, you know, which ones we can harness to communicate a certain health message. Sometimes certain topics can be conveyed through humor, through even just like any way we can to reach a certain target audience. So for TikTok, for instance, you know, some of those dances and skits are really a great vehicle to communicate some of those health messages to a younger audience, but that might not work for, you know, my colleagues, for instance. And so I have to package the message a different way, you know, and you know, in order to get that message across. And you know, the information that my colleagues are seeking is a little bit different. They're looking for something a little more granular and more detailed at times. So I try to, you know, adapt to all that.
So Lisa, you know, obviously we've seen a huge spike in patient and consumer engagement with professional content physicians on Twitter. Can you maybe describe some of the ways that you've seen this dynamic kind of come to life, especially over the past year, and also just any other major trends that you're seeing within maybe other healthcare communities on Twitter?
Right. So there's, you know, this past year since COVID started has really been seismic in terms of how people are engaging on the platform. And I think really what the biggest theme I see is that it's just been this unbelievable humanizing of health in general and of healthcare workers and of, you know, how people view their doctors. And so I think whether it be just the overall move towards digital and HCPs that are more savvy with digital, they're definitely doing better in things like telemedicine, which is where I think things are going. But you're really seeing, I mean, there was all this civil unrest in over the summer, you saw a whole movement on Twitter, Share the Mic Doc, where they would, white doctors would give their mic to doctors of color to share a different perspective. You're seeing, you know, World Health Day, where it was all about applauding healthcare workers. So you're seeing a more human angle, I think, whereas before, you know, doctors have always been on Twitter and they've always shared information on Twitter, and public health officials have always shared information on Twitter. But I think now you're bringing in this angle that social is uniquely qualified to do. And I think specifically Twitter, because of our relationship with the HCP community, where it's really developing a much more human tone. And I think in the end, it's going to create an environment where people, it's the natural evolution of where the patient HCP relationship was going. Whereas before, you know, the generation before, it was like the doctor in the white coat and that's how you saw him, right? And what he told you to do, you just did. And that was the end of it. Now it's a very different relationship. And I think that opens up a tremendous opportunity for marketers to talk to these people outside of their white coats. And so, you know, reaching doctors in places other than just straight endemic, you know, HCP publications, and, you know, recognizing, I always say people view doctors the way my kids view their elementary school teachers. Like they go to school, they go home, they go in a closet, they turn their clothes around, they go right back into the school, and that's all they do. And I think what we see on Twitter is that healthcare providers are engaging obviously with health, but they're engaging with the Oscars, and they're also watching the Super Bowl, and they're also doing all these other things that people want to do on Twitter. And I think it's a great opportunity for marketers to look at the lens a little differently and say, okay, you know, now we've seen this more human angle and we need to talk to them as people, as opposed to just this group of people that's kind of like set off from the population by their white coat and their degree and things of that nature. So I expect more of that to continue and more interesting activations around that theme.
Yep. Absolutely. And I'm sure Austin might not totally agree that the people in white coats always get their patients to do what they suggest, but they're still pretty reputable.
We certainly try.
Yeah, right. So I guess kind of moving on to, I think, one of the most important topics, and I mean, probably maybe if not the most important topic in healthcare and maybe even the world right now, COVID-19 vaccines. So Lisa, you know, Twitter's really been, you know, one of the sort of, you know, I guess sort of at the center of a lot of the conversation around getting medical, like accurate and reliable medical information out to, broad parts of the population. And I'm wondering if you could maybe just tell us quickly about some of the policies that Twitter's put in place to ensure that people are getting, accurate and up-to-date information on COVID-19 vaccines and maybe even health information more generally.
Yeah, I think we at Twitter realized that the whole vaccination experiment of can we outrun the vaccine by getting shots in arms really is going to succeed or fail based on social, because that is where people are getting their health information. And so Twitter takes their role in that extremely seriously. And so we put out our COVID vaccine policy in December, but we already had a lot of things in place, whereby tweets would be removed if they gave misleading information about a treatment, if they gave misleading information about the prevalence or the danger. So we already had a framework. And then what we did is we expanded that as of December 21st to include any information that's false about vaccinations in general, that's any information about causation, about false claims about immunizations in general, any things about how COVID is treated, again, how serious it is, if the vaccine actually works, efficacy, safety, all of that. So we take that very seriously in terms of removing it. And I think it goes along with our overall brand strategy, brand safety strategy, where it's number one, all about helping people find accurate information quickly. And so we're working with states, we're working with NGOs, we're working with the CDC, we're working across the globe, because we have to remember this is a global problem. It's not just a US problem, and working with those organizations to make sure when somebody searches, they're given the proper information. And then it's about protecting the conversation and making sure that those conversations are safe. And that's where you have the labeling and the removing and things of that nature. And then it's all about partnering with the right people. And so I think these are things that we've been doing across the world for elections. We were doing around our COVID policy to start with, and now we're rolling that out and really getting specific into the vaccine.
Austin, can you maybe tell us a little bit about how you yourself or how some of your peers who are really active in social media and really influential in social media are using these platforms to communicate with different types of Americans about COVID-19 vaccines? And I guess by different types, I mean, how you're communicating with individuals that are, strongly believe in that safety and efficacy of the vaccines, or just trying to figure out when they're going to have access to it, versus those that might be on the fence and maybe, are reacting to some of the, misinformation or even just news about sort of, safety and adverse events.
I think that, many of us have different specialties and different clinical interests, and we kind of use that and try to speak about these vaccines through those lenses to approach different age groups and people with specific concerns about the vaccine. So if a health professional has an interest in health disparities, racial health disparities, whatnot, then they can comment on the vaccines through that perspective. And then likewise, people who have questions about autoimmune disease or pregnancy and how that relates to the vaccines, certain doctors can speak to that better. I also think, to Lisa's point about humanizing our profession, allowing us to share that we have the same questions as a lot of people. Throughout this past year, part of the confusion is that there's so many unanswered questions, and being transparent about how we don't have all the answers yet, I think, is really important. And also kind of sharing our own struggles with handling, life during the pandemic has been, I think, also helpful to see that, we're not just robots trying to push certain treatments or vaccines, but that we also, have to deal with the same thing at home. We have to also, the repercussions of the pandemic apply to us as well.
Maybe as a follow-up question to that, Austin, can you, do you feel like you need to communicate to other healthcare professionals as well as sort of the broader kind of American kind of patient audience when it comes to vaccine safety and sort of vaccine effectiveness on social?
Yeah, sometimes. I think that it becomes a sort of a different conversation. It becomes more of a discussion because we can come at it from that sort of similar scientific perspective. But I think that there are some health professionals out there who disagree with some of the recommendations that are being put out there. And at the end of the day, I think that even for someone like myself, who's a gastroenterologist, I really defer to my virology colleagues, my immunology colleagues for certain specific questions. And we all have to also have a bit of responsibility when it comes to making sure that we're not speaking outside of our wheelhouse.
I think too, one of the things when we talk to clients, particularly clients that have vaccines, and they're looking at how do you move the needle to get to herd immunity, to get enough people to take the vaccine, I think part of the challenge is that there's so much data around about what they're effective at and what they're not effective at. And I think it is kind of incumbent upon the healthcare community to distill it down and say, okay, here's what's important. What's important is that all of these vaccines will keep you out of the hospital and off a ventilator. They're not going to keep you from getting a cold. COVID viruses, SARS viruses have been around a long time. We're not going to get rid of it. This is the goal of the vaccine, and this is what the vaccine is intended to do. And that's it. Like, it's very simple, but I think there's so much interest and so much data around, it did well against this cohort or this variant or that variant. And really, at the end of the day, what we're looking to do is to keep people out of the hospital and to bring down death. And that's it. And I think there's a kind of a leadership void there because it's been allowed to continue. And I think, you have really two camps. You have people who won't leave their house. And then you have people who are partying at the bar. And it's neither is really the right answer. And I think in the absence of having that authority, it's incumbent on the pharma marketers. There's this new trend that came out in Fierce Pharma this week around people just not wanting to be told what to do. That's a new thing that these marketers are going to have. So how do we unpack that? How do we help people understand? People tell you what to do all the time. This is not a first. So it's become something where I think social is the ideal platform where this is going to be parsed out because it's become very emotional. And I think we're really counting on science, and whether it be the HCPs, whether that be the public health officials, whether that be the pharma companies, to break it down into what we're actually trying to accomplish here. Because when you kind of blur that out, it really is quite simple. But that's been lost. And I think that's the part of the dialogue that the HCP community and the pharma community have to take back.
Yeah, and not to plug W2O, but the Fierce Pharma paper, that was actually something that we published that Fierce Pharma covered. And yeah. It's interesting. One of the things, and this also I think speaks to the value of social media and Twitter in particular as an amazing insight engine, not just a platform for communicating, but you can really understand some of the motivations behind these different parts of the American population based on what they say in social media above and beyond what you can get from polling data. And one of the things we did see was that it wasn't just right-leaning groups, and some of the types of people that I think many of us assume are the sole individuals that are they don't want to take the vaccine because they don't want to be told what to do. But we saw that across the political spectrum. It's not just right-leaning Republicans that are they don't want to be mandated to take the vaccine. We saw a lot of people on the left that also don't want that sort of mandate. Right. And it gives you a lot of clues into sort of how to best communicate with people in a way where it's not heavy-handed and it's you're highlighting the fact that it's an important choice, but a choice nonetheless. And but anyway, a lot of those insights that you get from those social media conversations are invaluable in terms of, I think, communicating the best way and thinking about the path ahead.
Yeah, absolutely. You have to understand where people are coming from in order to hopefully sway their decision.
And I guess,
sorry, Austin.
I was just going to say, I think that, as medical professionals, we're so used to working behind closed doors, which is, I think that the reason why people lack trust in us is that, we have to maintain our patient privacy. And so, in doing so, I think it makes people feel like, oh, what are you trying to hide? But I think social media has given us a way to, kind of shed some light on what's actually happening in hospitals. And even those of us who've gotten the vaccine, been able to share hey, we're suffering, the side effects. I didn't feel so well after the first day, but it's okay. This is what we think is important to get done because the risk of getting COVID is far worse.
So thinking a little bit about the road ahead when it comes to certainly vaccinations and COVID-19, Lisa, can you tell us a little bit about the work that you're doing with the COVID-19 working group at Twitter and some of those efforts?
Yeah, so COVID has been really, I mean, a massive, massive effort across the Twitter organization. And so we have what's called a Twitter, the COVID working group. And it's everybody from site integrity to ads policy to people on the sales side, to people in specifically brand safety. So it really runs the gamut. And, the whole idea, and it becomes very complex. So when the crisis first started, Twitter actually had a policy that said, you can't mention COVID at all in your ads, because our biggest concern was people spreading false information or people profiting from either false information or even just profiting from COVID. But then it became very clear, well, wait a second. What about Abbott Labs that's developing tests? People want to hear about that. J&J does a whole campaign around the road to the vaccine and talking about scientists and what's involved. Like, these are really important pieces of information. So then it shifted to, we actually whitelisted certain accounts to talk about COVID because we felt like it was important. So, we started in a place of clamping down misinformation and making sure nobody was taking advantage to, wait, how do we get the right information to the right people quickly? And how do we make sure that somebody coming on the platform from the state of Idaho gets the right information about a vaccine versus the state of Louisiana, because it can be very different. And how do we make sure, so yes, a big piece of it is clamping down the anti-vaxxer community that's spreading information that's not correct, and making sure people aren't saying, oh, I've got this new test I want to sell, and people buy it that's not approved by the FDA. But equally important than that is getting the right information to the right people and making sure companies like a J&J that are out in the market talking about something that people want to hear about are able to do so. And then it's really working with all the governments and the NGOs, which is incredibly complex because different vaccines are approved in different countries. The mentality around vaccines is different in different countries. So really making sure that, we have a hashtag called Know the Facts. And so when you search anything around COVID, it will take you to a CDC page, or if you're in a certain country, it'll take you to their public health body of information. So it really centers on taking the complexity and distilling it down so that users are able to get information that's actionable very quickly, because you can go in a rabbit hole online, as we all know. And so they want to make sure like that first thing you see is something that's highly credible.
Absolutely. Well, Austin and Lisa, I can't believe that 25 minutes already flew by. That felt really fast. But I really enjoyed the conversation, and I can't thank you both enough for joining us today. Like, this is easily, this is the biggest, sort of challenge, I think, certainly of our lifetimes. And it's been great to talk to, the both of you who are really at the center of helping us get out of the pandemic and doing that through really positive communications. So, again, really appreciate the time. Thanks again.
Thanks for including me.
Thanks for having me.